Dr. Sukantas here. As you all know, 14th of November every year is celebrated as World Diabetes Day. Now, why 14th of November? Now, 14th of November is the birthday of Sir Frederick Banting, who, along with his co-scientist Charles Best, had discovered insulin almost 100 years back in the year 1921. And they both had got a Nobel Prize for this because the discovery of insulin has revolutionized the treatment of diabetes and was a remarkable discovery in the field of medical science and in the field of diabetes treatment in particular. And ever since its discovery, it has saved millions of lives. Now, coming back to 14th of November, it is an initiative by the International Diabetes Federation in the year 1991, along with an active support from World Health Organization. Now, why World Diabetes Day? This day is celebrated with some theme to spread awareness about the global burden of this disease. This year's theme is Breaking Barriers, Bridging Gaps, Uniting to Strengthen Diabetes Well-being. This basically highlights the daily challenges faced by millions of people suffering from this disease, either knowingly or unknowingly. Now, managing this condition requires challenges, facing challenges with a lot of resilience, organization, and responsibility, both at an individual level and at a collective level. Now, if you just look at the statistics, what are the statistics about diabetes? First, let us look at the global statistics. Statistics suggest that in the year 2021, the global burden of diabetes was 537 million people in the age group of 20 to 79, which if uncontrolled, which if remained unchecked, can reach to 643 million by the year 2030 and a staggering rise to 783 million by the year 2045. And the most shocking fact is that almost half of the persons, almost 1 in 2 persons suffering from diabetes are actually not aware of their condition. And diabetes is no longer a disease of the rich or disease limited to developed nations. In fact, 3 out of 4 persons suffering from diabetes come from low and middle income countries, and majority of them, even in high income countries, they are concentrated in low income areas and lower socioeconomic groups. Therefore, it is all the more important to understand about diabetes, the global burden, and the implications related to that. Diabetes statistics for a country like India. Of late, India is being called as the diabetes capital in the world because of the large number of diabetes population in India. India has nearly 77 million people suffering from diabetes, and almost 25 million people are suffering from pre-diabetic condition, which can turn to diabetes at any point of time if left untreated. What is also more important is that over 50% of people in India are even unaware of their condition, that they are having even this disease. And if left untreated, the number can rise to 134 million by the year 2045. If we can put things into perspective, the year 2020, India had almost 32 million diabetic people, and if it becomes if we just look at the present number, it is 77 million. So almost reached 3 times of that number. And if left untreated, unchecked, then we already have so many challenges related to health problems in India, and diabetes, along with its complications, is going to add injury to that existing burden of health challenges for this country. Therefore, it is all the more important for all of us to realize the value of World Diabetes Day and implement the various measures for prevention, for diagnosis, and for management of diabetes and its various complications. What is diabetes? Diabetes is a group of metabolic disorders which are characterized by high blood sugar levels, which can lead to a variety of complications if left untreated or poorly managed. The basic mechanism, now just look at a simple situation I would explain for your easy understanding. Whenever we eat, we take a meal, the glucose in the meal is absorbed into the bloodstream, of course, after digestion in the intestine, after being absorbed into the bloodstream. Once the glucose reaches bloodstream, insulin that is present in the blood actually helps in glucose uptake by the cells by insulin signaling, and it sensitizes insulin receptors on the cells. Now, insulin, as many of you are aware, is secreted by beta cells in the pancreas. And ultimately, when glucose reaches the cells, there is utilization of glucose, which is the primary source of energy in human body. Glucose is metabolized, glucose is utilized, and sometimes glucose is also stored into glycogen. Insulin is the most important factor here for us to understand. So diabetes develops whenever there is either deficiency of insulin because the islet cells are not able to, or the beta cells are not able to secrete adequate amount of insulin, or there is insulin resistance where the cells become less responsive to insulin by reducing glucose uptake. Thereby, either way, whether if there is insulin deficiency or insulin resistance, there is accumulation of blood glucose, or which is known as hyperglycemia or high blood glucose levels. And the primarily high blood glucose levels in diabetes is the root cause of all problems. Types of diabetes. Diabetes is basically divided into two different types, type 1 and type 2. Type 1 diabetes characteristically develops in early childhood or adolescence, and here the body either produces little or no insulin, but one has to understand that in all such conditions, the body requires insulin therapy. And the causes can be autoimmune, where the body's immune system acts against its own beta cells in the pancreas, destroying the pancreatic beta cells, and sometimes be due to genetics plays a significant role, and sometimes it could be environmental factors like viral infections or toxins. The cornerstone of therapy in type 1 diabetes is insulin, along with, of course, blood sugar monitoring and exercise and lifestyle modification. In type 2 diabetes, there is insulin resistance as a predominant mechanism. The body cells become less responsive to insulin. There is also sometimes pancreatic beta cell dysfunction. Some of the factors contributing here are obesity, genetics, of course, plays a significant role. It has certain characteristics. It develops in adulthood. The body produces insulin, but it produces insulin insufficiently. And many times patients may not require insulin therapy, but in advanced stages, they may still require insulin therapy along with certain glucose lowering medications. What is common to both type 1 and type 2 diabetes is high blood sugar levels. And the approach, of course, along with insulin in type 1 and in type 2, either glucose lowering medications or insulin. And in both the cases, what is important to remember is lifestyle modification, healthy lifestyle and exercise, regular physical exercise. All these are cornerstone in both type 1 and type 2 diabetes mellitus. Elements to remember in the treatment of diabetes. One, of course, is blood glucose monitoring, regular testing for blood sugar levels, as well as maintain a healthy lifestyle, maintain a regular physical exercise, maintain healthy body weight. And just for your information, I will tell you some of the important drugs that are, or class of drugs that are used in the treatment of diabetes, or the most common and popular drugs. One is metformin, which is otherwise known as a group of from a biogonate group of drugs. The first line of therapy for type 2 diabetes. Till now, it has been a drug that has been there for decades, but still forms one of the most important mainstays in treatment of diabetes. Second one, of course, is sulfonylureas, where the kind of drugs which actually include glipizide, glyburide, glibenclamide, and all these things stimulate insulin release from the pancreas. Then we also have meglinides, thiazolidinediones, and DPP-4 inhibitors, for about which I will tell in little more detail later on, and GLP-1 receptor agonists and SGLT2 inhibitors. The last three group of drugs we'll discuss in further detail: DPP-4 inhibitors, SGLT2 inhibitors, and GLP-1 receptor agonists. And the last but not the least, the most important element in diabetes treatment is insulin. And in type 1 diabetes, as I have already told, insulin is the mainstay of treatment. In type 2, along with OHA, insulin forms an important or adjunct to the treatment when OHS do not work, or the insulin or the patient is very sick to take OHS, or especially in patients who are admitted in intensive care units, or patients are very sick, then insulin takes over OHA as the mainstay of treatment. 4 inhibitors and GLP-1 agonists I will discuss these drugs one after another because their mechanism in some way or the other is interrelated to each other. GLP-1 agonists basically mimic GLP-1 or glucagon-like peptide 1, enhancing insulin secretion and suppressing glucagon. Glucagon is the hormone which increases blood sugar levels, whereas insulin is the hormone which decreases blood sugar levels. GLP-1 agonists also delay gastric emptying, thereby reducing the appetite. Some of the examples are semaglutide or Ozempic, then we have liraglutide, then we have got exenatide, and we have got dulaglutide. Their benefits: they give improved glycemic control and weight loss. Weight loss by these drugs has become an important topic of global debate and discussion, and sometimes there are certain controversial areas related to the off-label use of GLP-1 agonists in certain countries. And of course, they have got certain cardiovascular benefits and also potential renal benefits as well, but they come with certain side effects such as gastrointestinal side effects, nausea, vomiting, diarrhea, and injection site reactions. The DPP-4 inhibitors, as opposed to GLP-1 agonists, are actually enzyme inhibitors. They block DPP-4 enzyme, and DPP-4 enzyme is responsible for degradation of GLP-1. So when this enzyme is blocked, it increases GLP-1 levels and also GIP-1, that is gastric inhibitory polypeptide, and these two actually facilitate in insulin secretion, suppressing glucagon. And some of the important examples of DPP-4 inhibitors is linagliptin, sitagliptin, vildagliptin, saxagliptin. So there are so many gliptins. These are normally known as gliptins. They also have the benefit of improved blood glucose control. They are mostly weight neutral. There is a low risk of hypoglycemia. Low risk of hypoglycemia is an important adjunct and advantage of these medications. And in case of linagliptin, one has to understand that it is very safe as far as renal patients are concerned. It has the safety of being able to be given at advanced stages of kidney failure as well. SGLT2 inhibitors. SGLT2 inhibitors are those group of anti-diabetic drugs which, by inhibiting SGLT2 in the kidneys, SGLT2 is otherwise known as sodium glucose cotransporter. By inhibiting SGLT2, they actually block reabsorption of glucose in the kidneys and increase glucose excretion, which is known as glucosuria, thereby lower the blood sugar levels. They have got added advantages by improving glycemic control, causing desired weight loss at times. They of course help in, they have got various cardiovascular benefits, kidney benefits, or delaying chronic kidney disease, and also have got benefits in lowering of blood pressure. Some of the examples of SGLT2 inhibitors are empagliflozin, dapagliflozin, canagliflozin, and these are the three most important drugs. And of course, we have got sotagliflozin and etugliflozin as well. These medications are often used in combination with other diabetic medications, along with the mainstay of treatment such as diet, exercise, and sometimes also with insulin therapy. SGLT2 inhibitors have been shown to have additional benefits such as their benefit in reducing hospitalization for heart failure, slowed progression of kidney disease, as I just mentioned, and reduced risk of stroke and kidney damage. However, with any medication, these medications are not without side effects. They can cause increased incidence of urinary tract infections. Sometimes there is minimal but low risk of allergic reactions, yeast infections, and it is important to always, whether it's DPP-4 inhibitor, SGLT2 inhibitor, or for that matter GLP-1 agonists, these medications or any anti-diabetic medication or insulin has to be taken with the advice of a proper physician or a diabetologist or an endocrinologist or a medicine specialist. Whoever is qualified, from that person's advice, patients need to take these medications. Artificial pancreas. An artificial pancreas, also known as a closed loop system, is actually a medical device that automates regulation of blood glucose levels in individuals with diabetes. It is a small wearable device that combines advanced technology and artificial intelligence or AI to mimic natural pancreas function or nature's pancreas function. Components of an artificial pancreas. An artificial pancreas has three predominant components. One is continuous glucose monitoring, otherwise known as CGM system, that tracks glucose levels in real time. Remember, in real time, every 5 to 15 minutes using a small sensor inserted under the skin. Second one is control algorithm, an advanced software that analyzes CGM data and adjusts insulin doses accordingly using complex mathematical formulas. And third, of course, is the most important or therapeutic arm, that is the insulin pump that delivers insulin to the body based on algorithms instructions. Now, how does an artificial pancreas work? Actually, it's the continuous glucose monitoring system that tracks the blood glucose levels and sends data to the control algorithm. The algorithm then analyzes this data and determines the appropriate dose of insulin, and then subsequently the insulin pump delivers insulin doses. The CGM system actually keeps a continuous track of glucose levels, and the algorithm adjusts insulin doses accordingly. The benefits of an artificial pancreas, of course, are automated regulation of blood sugar to maintain normal blood glucose levels at all times. And there is, of course, a reduced risk of hypoglycemia, because hypoglycemia is a major challenge, or hypoglycemia, otherwise known as reduction in blood glucose levels. The system actually detects low blood glucose levels and adjusts insulin doses to prevent hypoglycemia. It, of course, enhances the quality of life, which is, of course, the most important thing for us to desire, because fewer manual blood glucose level checks and fewer insulin injections, and the reduced diabetes related stress. Reducing stress is the most desired aspect here, and there is increased flexibility. You should allow the diabetic patients to have more flexibility in day-to-day activities, in their meals and exercise. But artificial pancreas is work in progress. The current status is that there are several different models, several different artificial pancreas systems are approved and available in different countries. But a lot of research is ongoing to make the device more mobile, more easily wearable, and more easily patient friendly, more easy to track, and of course free of complications or free of malfunction. So let's wait and see how the whole artificial pancreas segment works, and how we have wonderful things in store for future. How diabetes can impact the kidneys? Diabetes can significantly impact the kidneys, leading to diabetic nephropathy, leading cause of kidney diseases in the world, leading to end-stage kidney disease and the requirement of dialysis or transplantation. Now, how does it all happen? Diabetes actually causes, in the early stages, increased blood glucose levels, increased blood flow, and glucose levels damage the kidney filters. This is known as a stage of hyperfiltration, and there is consistent damage to the nephrons in the stage of hyperfiltration. Subsequently, there is also inflammation. High blood glucose level is a very significant cause of inflammation, along with oxidative stress, free oxygen radicals. They together form a cascade of reactions that can damage the nephrons. Gradually, these short-term effects lead to long-term effects, causing nephron damage, which is initially, maybe it's a stage of reversibility, but gradually it gives rise to an irreversible stage, causing permanent damage to nephrons, which are primary functional units of the kidneys, reducing the function of kidneys. Then subsequently, there is even ores in store, there is fibrosis, scarring of the kidney tissues, leading to chronic kidney disease. And how does it manifest? In the early signs, starting from early days to later on, we can see albuminuria. Albuminuria is basically leakage of albumin, a form of protein, into the urine, which also is a cause and also a manifestation of kidney damage. And that is, of course, decreased kidney function manifested by reduced glomerular filtration rate, and gradually all these things inadvertently lead to end-stage kidney failure requiring dialysis or transplantation. Now, what are the stages of diabetic nephropathy? Nephropathy or diabetic kidney disease goes through 5 different stages. Stage 1 is the stage of hyperfiltration, where the glomerular filtration can be higher than normal. Paradoxically, in stage 1, GFR is higher than normal. In stage 2, there is stage of microalbuminuria. There is slightly elevated level of albumin in urine, that is around 30 to 300 milligrams. And in stage 3, it is macroalbuminuria, when the albumin levels are significantly increased, and in stage 4 there is reduced GFR and kidney function declines, and stage 5 is end stage kidney disease or kidney failure. The risk factors for diabetic kidney disease, of course, if there is a family history of diabetes with kidney disease, if there is significant obesity, if there is smoking, if there is hypertension, if there is poor blood glucose control, uncontrolled hypertension as I just said, and of course sometimes the overall duration of diabetes can be an impactful factor in all this as a causative factor in diabetic kidney disease. And how do we manage that? Just like we manage diabetes as a whole, we have to look into the management of diabetic kidney disease and appropriate blood sugar control, appropriate blood pressure control, and monitoring of blood sugar and blood glucose, avoiding smoking, and maintaining a healthy body weight, maintaining a strict regular medication for and timely detection of other associated complications. And remember, diabetic kidney disease can also give rise to significant cardiovascular complications, stroke, anemia, bone disease. All they will together give rise to a multiplicity of problems on a person's existing health burden. Therefore, we have to look into the treatment modalities. Insulin forms a mainstay of therapy, but before going for insulin, one has to look at what are the drugs that can help in delaying progression of chronic kidney disease. Some of the drugs that have come of late that can delay the progression of diabetic kidney disease are SGLT2 inhibitors, and GLP-1 receptor agonists can also be beneficial, and of course non-steroidal mineralocorticoid receptor antagonists such as Finrenone. These drugs can significantly delay the progression or worsening of diabetic kidney disease. So one has to remember, with appropriate diet, with appropriate medication, lifestyle modification, and sincerely being aware and a disciplined life can significantly lower the risk of diabetic kidney disease and help in better prevention, diagnosis, management of diabetes.